Like to discuss the differences between nurses and doctors. There is a bias when there are educational requirements to become a registered nurse, and in this slide, I would like to discuss two pathways you can take. After high school, there are two degrees you can obtain to become a registered nurse. The first one is the Bachelor's in Nursing, which is a 4-year program, and the Associate's degree in Nursing, which is a 2-year program. Both of these programs set you up for the NCLEX exam, which is a registered nurse exam. Once you have passed the NCLEX exam, you are ready to get out into the real world and work. So now let's talk about my interview with Christina Jankowski, who is a registered nurse in the ER at Danbury Hospital in Connecticut. She has an associate's degree in nursing and is finishing up her bachelor's in nursing. I was able to get into an interview over Zoom, and I was able to answer all the questions I really wanted to ask. The first question I asked Christina is, what is the workflow and environment in the emergency room? The first point she made is that it is a high stressful environment. To further describe why it is such a high stressful environment, she stated that she has to decide the best course of treatment on the spot quickly in an emergency. Going off of that, one of the biggest questions that I was excited to ask Christina is, what are some cases of things that happen in the ER, and what do you do as a part of the care team? Starting with the less severe cases, she mentions when somebody comes in with a laceration, she is able to clean the wound properly and the doctor comes and stitches it up. Or even when somebody comes in with abdominal pain, she takes blood work and puts in the IV and administers pain medication, as well as monitoring the progress and documenting it. And with the more severe cases, she did have somebody with cardiac arrest. She was pumping medication in this high stressful moment, and she was able to shock them with a defibrillator to see if they could get the patient back to life. Fast decision making is important in the ER, especially with patients like these, where they need immediate service right away. What does Christina like most about her profession? One of Christina's favorite parts about being a nurse is being bedside and taking care of patients directly. She is able to monitor patients by collecting vital signs, giving them medication, and documenting their progress. She also mentions that she loves the relationship she builds with patients. Being able to be a friend and a shoulder to lean on is something she loves about her job. Throughout her monitoring, she is able to keep track of the progress of the patient and advocate for the patient if they need necessary treatment. Christina also states that she is a person that loves to stay busy, and this job is perfect for her. She always enjoys the fact that she has a task to do, which keeps her job extra exciting. Some things that Christina dislikes about her profession is the fact that it can be emotionally taxing. She expresses it can be emotionally draining seeing patients suffering and being exposed to traumatic events that come her way in the ER. She also states that she is constantly on her feet, which makes her very exhausted. And lastly, it is a high stressful environment because of the unpredictable patient flow and the overall pressure for quick decisions in an emergency. Some advice that she gave me was you should always keep up with your learning and tuning up your skills. States that learning doesn't stop after you graduate, and there's an endless amount of new things out there to learn in the medical field. Christina also says that engaging in hospital events and building relationships with coworkers is so important. She says that it even makes the workflow of the care team even better. Also, being a part of hospital events and doing a little extra can go a long way. It does also help her to avoid just going through the motions of her everyday job. Lastly, Christina makes it clear that taking care of yourself is super important. If you aren't taking care of yourself, how will you be able to take care of the patient to the best of your ability? It's impossible. Making sure that you take care of yourself mentally and physically and spiritually will help you take care of a patient to the best of your ability, she states. And being careful is important in the ER and staying alert. What personality do nurses need to have? Well, they need to be passionate about the job, Christina mentions. It is a very mentally and physically draining job, but loving what you do can make it easier. Being selfless is something Christina also said nurses need to hold. She states that you will have to be willing to help patients day in and day out, no matter the circumstances. And she also mentions obviously being hardworking because the job entails a lot of hard work. Some things I learned, what surprised me, and what I took away from this interview. I learned that nurses are really brave and tough people overall. I also learned about how nurses play a crucial role in the healthcare process for patients. They are a support system and assist to not only the physical needs of patients, but the mental and spiritual needs as well. They are a crutch and a shoulder to lean on. What surprised me about my interview is how much of an impact nurses have on a patient as compared to a doctor. My whole life, I never thought nurses played such an important role in the health of a patient. Doctors work with patients on a clinical basis, but as compared to a nurse who works continuously with their patient, monitoring them and monitoring them in their progress. Interviewing Christina really helped me see what a life would look like for me as a nurse. Do I feel more or less interested in this field? I feel even more drawn to being a nurse than ever before. I love to be hands-on and build relationships with my patients. Having previous experience as a CNA has also played a huge role in why I want to be a nurse. It is an unexplainable feeling to be able to make a difference in someone's life like Christina does in the ER. What was also nice about this interview is I realized that I might not enjoy being an emergency room nurse only because of how fast-paced it is and how mentally draining it can be. You do have to be a certain type of person to be able to deal with all the highs and lows of the ER. Making a difference is my main goal when I want to be a nurse for the rest of my life. And listening to Christina's experiences as being a registered nurse really made me realize that this is the profession for me. But overall, I am so happy I did this, and I got to find out a lot about what being a nurse is.